As you know from your involvement with Heterodox Academy, one of our main ideas is that the university is in some sense a special place, separated from the ordinary run of politics, a place where people can go and put their guards down, join in conversations with one another, with humility, recognizing the things they don't know and want to learn, speaking openly about their weaknesses. But all of that depends upon the forces of politics, of ordinary politics, not washing over the walls of the university and covering up the campus.
Right.
But I think in many disciplines, many professions, that's the case, or it should be the case, that same ideal that this professional area, say in law, for example, or in medicine, or in therapy, that if politics is allowed to wash over the walls, so now you have doctors making decisions about their patients based on their political views, what treatments they get them, whether they see them at all,
Right.
or you have lawyers saying, I won't take clients of these different categories, or I think no one should take a client of that type. That just is a destruction of the profession. But in therapy, what do you see there? It sounds like that washing over is there anything pushing back against that washing over?
Well, I mean,
Professional norms, for
just
example?
just to kind of like underline your point first about how damaging that worldview is. I mean, I think the bias has to get pretty bad before you get leaders of professional associations advocating this type of what I would say is extremely politicized approaches. So all the other layers of bias that I mentioned at the beginning, I think they've been there for a while and they've really ossified into something else. To me, the when you're kicking people out of therapy for majoritarian political views, that's a canary in the coal mine, that the bias situation has gotten much more severe. The therapeutic relationship is very intimate. It's very personal. You really have to be open and curious and um, empathic to people with a wide range of views. You can't kind of just fake it or not have knowledge or have real hostility and do good work. So I think the it's the tip of the iceberg of this huge iceberg of bias, and I think there's a lot more under the water. Um, what's the pushback like? Um, therapists are very scared to speak out about these issues, and the biggest fear is that if they talk about problems in the field, they will not get referred patients. They're worried about other things. They don't want to lose they don't want to lose friends. They don't want to be attacked. They don't want to get sued by patients. If they find out you're a conservative or you have a conservative view, then maybe somebody will file a complaint with your licensing board or something. So they tend to have fears like this. I don't know how common those things actually are, but therapists are very worried about them.
But isn't there an official body that sets professional norms, states professional norms? Is there a group that says therapy is a specialized place? It's not the place for you to do political campaigning or other kinds of moralized.
Yeah.
Are there leaders in the field who remind people of what the ideals are professionally, but the ideals are being not observed being observed in the breach rather than being supported and reinforced? Is that the way
Um,
therapy works?
I mean, it's probably the way it should work. But I don't. A lot of the professional bodies are some of the most politicized parts of the field. I mean, the APA. There's the Association for Social Workers, for counselors. Um, there's university training programs. There's psychoanalytic training programs. I mean, so many of these have gotten really aggressively politicized, and it's actually running the risk of kind of death spiraling because people don't want to enter the field to go through a graduate program that's very intensely politicized and hostile to them. So if you're not on board with these ideas, the idea of spending 3 to 6 years in graduate school, having to self-censor and feeling attacked, it makes people say, I'm not going to enter the field. So it could, it's kind of already reached a very radical point, but I think it has the potential to just kind of continue to spiral.
It's fascinating. And so now tell us about the Open Therapy Institute.
So the Open Therapy Institute. So I think one of the things that was on our mind when we were founding the Open Therapy Institute was not limiting the discussion to just the most extreme forms of bias. We do want to talk about those. They are really important. They're happening more than people probably could imagine. But we wanted to talk about the other forms of bias too. The way that therapists might make assumptions about patients, that could be pathologizing. Oh, you're a Trump voter, it means you're a narcissist, or it means you're dumb, or whatever, or other biases that they might have. This group's privileged, or this group's always a victim, or something. And we wanted to actually think about what are all the different ways, what are all the different issues in mental health where bias manifests, where things might not get addressed and talked about that could come up in sessions? What are all the different ways that bias might manifest? It could be, a faith-based issue. It could be around religion. The field is very secular, very atheistic field. I think I saw something that's most atheistic profession, which kind of surprised me.
Fascinating.
But
That's fascinating.
but most patients aren't. So there's a big gap. And a lot of, like, when I was in graduate school and I did my PhD, I didn't have a single lecture on religion.
Fascinating.
So most therapists that I know in New York don't ask about religion in the intake. They don't ask. So and then if it did come up, I think a lot of them have the assumption that being culturally competent around religion means being nice about it. So you're nice to them, but you don't know anything about it. You don't engage them with it. You don't have faith-based interventions or suggestions. You don't bring it into your formulation. You don't have any thoughts about it. And so I think that's an example of the type of bias that's happening around other things. And it could be politics, it could be self-censorship, it could be masculinity issues, it could be racial issues. We had somebody who's giving a talk in a couple months who's talking about gun owners. There's a history in mental health of pathologizing guns and gun ownership. Gun owners know this. They're very mistrustful of the mental health profession. They're worried that they're going to get reported and red flagged. And so gun owners who need therapy are often very mistrustful of the field. And that's true for dozens and dozens of populations like that.